Good evening, everyone, and welcome to Introduction to Surgical Extractions in the Dog and the Cat. This is the second of a 5-part webinar series on extractions, and we're attempting to make this extremely widespread, but at the same time very detailed. When we're looking at the webinar tonight, which is going to point out a lot of things that we want to avoid and a lot of landmarks surgically that we'll be utilizing in the next 3 webinars, which are more specific in dealing with the individual teeth, the canines, the premolars, and the molars. So we'll get started right away. I am Brett Beckman. I'm a veterinary dentist and a diplomat in the American Academy of Pain Management. Know many of you already. For those of you who don't know me, I see patients in Atlanta once a month, and Orlando and Punta Gorda, Florida, both once a month as well. And I am the past president of the American Veterinary Dental Society. So to get started, let's take a look at a tooth here, or a set of teeth, actually. Let's look at this first molar on the left mandible, and then the second molar next to it. And you'll notice that there's some bleeding in the interdental space and the sulcus between the molar and the first molar and the second molar. And what I'd like you to see radiographically is that we've got a situation that would definitely necessitate surgical extractions and a lot of decision making on where to make incisions and how to approach these teeth. If you'll note that the distal root around this first molar has been compromised from a periodontal standpoint fairly significantly with all these defects here, these lucencies, and more importantly, probably, as far as difficulty goes, we also have involvement with this second molar. This tooth in particular, and we'll see this more specifically when we talk about the molars in the last of these webinars, is extremely difficult in some cases to extract, and this probably would not be an exception to that. There's a lot of dense cortical bone that surrounds this individual tooth. These roots are fairly thin and pretty fragile. They can be long, they can be curved like this one is, and in this particular tooth, this mesial root probably wouldn't be that much of a difficulty extracting, because you can see there's been some bone loss around that, as evidenced by the enlarged periodontal ligament space around it. But on this tooth, we've got less of a pathology situation. This is more encased with pretty dense cortical bone around this whole alveolus, and so it would be a little bit difficult to get that out of there, and very easily can we fracture that tooth root. If it's fractured, we have to go after the root itself, and that can be difficult in the back part of the mouth. So this same tooth orientation with 2 roots in the maxilla in the front part of the mouth, the mandible in the front part of the mouth, wouldn't be that big of an issue. But when we're looking at access really far back in the caudal aspect of the oral cavity, that can be a factor. So in looking again at these teeth and considering extraction of these 2 teeth, we would definitely want to use some type of flap to expose the bone, not only to allow us to remove some of the bone surrounding these roots on the vestibular aspect or the buccal aspect or the lateral aspect of that bone. We also would be exposing the area so that we could clean up all of the what appears to be a void here, which is actually granulation tissue and or calculus, which you can see here, debris, food debris, hair, many things down into these defects that if we just extract the tooth root and we leave, can be problems with chronic infection, pain, and may never heal correctly.